Hi, everyone. Welcome to RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator, Dr. Stasha Gominak, answering some of our frequently asked questions, as well as others you may not have thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. So, Stasha, what happens to our bodies if we do not get enough sleep?
Hi, my name is Stasha Gominak. I'm a retired neurologist, and now I work as a sleep coach. And Heather and I are making a series of short videos about questions that are commonly occurring. This one is a particularly interesting question because, as far as I'm concerned, none of medicine was trained that sleep played a role in actually causing disease. We've always thought that disease was something that came from without and attacked us. Originally, a lot of things were infectious diseases. And in the last 100 years, medicine has really gained a lot of power over the infectious illnesses and the epidemics. What we're left with now is an epidemic of humans that are not really normal humans because their D levels are low and their microbiome is no longer normal. That has led to an epidemic of sleep disorders, but also of several other chronic illnesses. And it turns out that those come together for very specific reasons. But now we've had a good 40 years of being able to see what happens to our population if 12-year-olds can't sleep normally, or 2-year-olds can't sleep normally, or 40-year-olds don't sleep normally. We entered into the sleep field with sleep apnea, and that was in elderly, overweight males who just had a coronary artery bypass graft. That was back in the 70s. But over the last 40 years, and especially in the last 10 years, it's become clear that insomnia is now an epidemic. Interrupted sleep is now epidemic. Sleeping but not feeling rested is epidemic. That is being joined by many chronic illnesses. Now, not all illnesses are related to how well we repair at night, but most of them are. So when I don't sleep well, what happens is my ability to repair my body, every single part of my body repairs itself to look the same when you wake up. Unless you're growing, you're in childhood and you haven't gone through puberty yet, when you will look different every few days, most of us who are adults repair to look exactly the same. So we don't get a big, clear message that we've actually repaired our liver or recreated a joint during the night. But that's exactly what we're doing. Now, the message we do get is, gee, I don't feel rested. I don't feel good. My joint hurts. I hurt it 5 months ago and it still hurts. So there are various things that tell us that our healing has not been complete or restorative. Our sleep has not been restorative the night before. The problem is that you can be sleeping for 12 full hours and feel awful every single day. And there's no message to tell you that you were asleep. Eyes were closed, you were aware that you were in the bed, you were probably more aware of the passage of time than you should be, but you did not get into any of the deeper healing phases of sleep that would allow you to repair your brain and your body and feel refreshed and ready to seize the day, enthusiastic, motivated, ready to come up with new ideas and change the world. If that's the way you feel, then we have the option of doing sleep studies now that show if you're not getting at least 2 hours of REM and 2 hours of deep sleep, there's something actually wrong with your brain chemistry. So this is what RightSleep is about. And because abnormal brain chemistry is now very common, sometimes accompanied by a problem with the airway, the actual tube that we breathe through, that also needs to be addressed in every single person. Because we now have studies that show those things, we can intervene in many ways. So you can intervene using a sleep dentist, a sleep doctor, many different ways to do sleep studies. You can buy yourself a sleep tracker. But RightSleep is the only program that actually addresses the deficiency states that have been scientifically shown to be related to not feeling rested and restored. In the final analysis, what this means is, if you've been told you have diabetes, if you've been told you have heart disease, if you've been told you have depression, if you've been told you have anxiety, you have panic attacks, if you are living a life that you know is not your full potential because you feel awful every day, there is a path for you to follow yourself to get your brain chemistry back to normal so you can sleep better and feel great.
I mean, I don't know about other people, but I have definitely had a few of those diseases. And since doing the Right Sleep program, much better. Much better. All right. So thank you everyone for joining us. Please subscribe to the channel, then like and share our videos. You can find more information as well as the Right Sleep program at drgominak.com. Remember, we see our doctor once a year because we heal our bodies every night. Until the next sleep chat, sleep well. Bye-bye.